So I'm going to start. My name is Bracha Banian. I am a family nurse practitioner and CEO of Ivy Drips and Hello Dose. I've been practicing medicine for over 10 years and been studying GLP-1s for the past 3.5 years. I'm a big advocate for GLP-1s. I believe they're a revolutionary drug, and I'm here to educate and help people learn how to use them. We are going to be going over a little bit more about what GLP-1s are, why would someone need it, why it's revolutionary, and how do I microdose. At the end, we're going to be taking questions. All your questions will be anonymous, and any comments you have, again, or you could, if you email them in, we'll be answering them today. And the last 15 to 20 minutes, we'll take questions from the chat or question and answer box. So, great. So, Ozempic or GLP-1s have been around since 2009. So they've been around for a while. Today, 2025, 1 in every 8 persons on a GLP-1, which is coming to show how they are being used so much and how revolutionary they are. They are changing healthcare and improving not only our health span, but also our lifespan. Last year, Bloomberg put out an article saying how the CEO of Walmart said that he saw a decrease in sales in the food department due to GLP-1s, which is showing us how many people have changed the way they eat due to these medications. So they're not just about weight loss anymore. They're about changing the way we see healthcare. And we're going to talk about that a little bit today. Okay. So as people are joining, I'm going to continue to say, if you have any questions, put in the chat box or the question and answer box. And at the end of the session, I'm going to answer all questions, whatever we have time for. I want to talk a little bit about weight loss and GLP-1s, what they do. And then we'll talk a little bit about microdosing, how you microdose, and how we really have a system to help people lose weight, but also keep it off. So let's just talk about weight loss for a second, because weight loss is multifactorial. There's so many different reasons why someone struggles with their weight. It's not just about calories in, calories out, and there's reasons why it's more difficult for some versus others. So with weight loss, we have different components. So one is hormones. Sometimes hormones come into play. An example of hormones coming into play is a woman who gained 8 to 10 pounds during menopause. She's doing nothing different, but she gained weight, and that's because her body's storing sugar differently. Metabolism. Your metabolism could change, and that could cause you to gain weight, or sometimes people just have slower metabolisms. Your genetics, sometimes you have certain type of genetics, and that's kind of what you're born with. It's almost like your pot of luck. If someone lives a very stressful life, they're going to have something called cortisol levels that are going to be very high. And when your cortisol levels are high, it causes your glucose and insulin to be higher, which causes you to struggle with weight loss. Processed food. Processed food is addictive. It's manufactured to make us want more. And so when that happens, the more we eat it, the more we want it. And so whether it takes a day or month or years, when our brain gets used to processed food, it continues to want more and more of it. And the problem is that it's high calories and it's low nutrient. And so processed food is an addiction, and it's important for us to realize that that is a factor. If we grew up eating processed food, that's going to make it more difficult for us to lose weight. Lifestyle, if you have a certain type of lifestyle where you're drinking a lot or going out to eat a lot and you're eating a lot of processed foods, or you grew up in a home where you had certain type of foods that you're accustomed to, our culture makes a difference. Insulin resistance makes a difference. So insulin resistance is something that's not spoken about. I think that is one of the most important things when it comes to becoming healthy. Your metabolic health, which is your glucose and your insulin. The higher your glucose and insulin is, which at a different time we'll talk about how to manage that, then the harder it is for you to lose weight. So someone who has been overweight their entire life, it's harder for them to lose weight because their body doesn't respond to the glucose and insulin cycle as much. And when that happens, it's harder for them to lose weight. So one person may have an easier time losing weight, but another person may never be able to really get over that hump to lose weight because they're insulin resistant. And then there's psychology and belief systems. Certain people have certain belief systems about how they feel about food on a very subconscious level. There's a lot of studies show that a lot of females who are overweight have been sexually abused when they were younger, and then they eat food to feel protected. There are certain people that, let's say, grew up in a home of people who went through the war, and so they grew up understanding that they need to save the food, and maybe they have to eat it now, or they may not be able to eat it later, and so that gets passed on from generation to generation. A body set point, right? Let's talk about body set point. If you have a certain set point, it's really hard to change that. What does that mean? If you weigh a certain amount for over a year, 2 years, 3 years, that becomes your body set point, which means your body's used to weighing that weights. And if you try to change it, it thinks that it's like starving. So for example, if you go on a trip and then you gain a couple pounds, when you come home, your body's actually going to shift back to the regular set point. And same type of thing, if you gain weight or lose weight, our body wants to stay at the set point. So if you've been a certain weight for a certain amount of time, it's much harder to change that set point. And so sometimes medications help with that. How habits play a role, right? So we sometimes have emotional triggers, and this is why eating and food is it's very, very connected to how we feel emotionally. So there's emotional triggers. Let's say we're upset at someone, so then we eat out of a certain emotion, and that ends up creating our habits. Habits are very hard to change, and only you could change your habit. There's no drug that you could take that could change your habit. It's only up to you. But what could you do that could help you jumpstart your journey that isn't changing your habit, changes the way your brain works, right? What if something's going to help with those emotional triggers a little bit? It'll allow you to make different habits. And so that's what this medication does. It helps change something in your brain to allow you to develop new habits. There's many different ways you can take this drug, which is so cool. You could take this drug by um, really just cutting your entire appetite and not eating, which is very dangerous, or you could take it as a tool to fix how you live your life and change the way your brain works. This is why education is so important when you're taking these drugs, because you have to understand how to use them and how the medication will play a role and how you will play a role. So whether you're microdosing or whether you're taking high dose of GLP-1 and you're taking it for, a long-term weight loss journey and you need to go to higher dosages, it doesn't matter. At this point, you always have to understand, what's the medication doing and what am I doing? And both have to play a part to have success. It's not just the medication. If it's the medication, then you will find that you may not have sustainable weight loss. So let's talk about why this medication is revolutionary. Okay, whether you're microdosing on it or you're going on it on a regular dosage, it doesn't matter. The drug almost the same. So we spoke about GLP-1 process. So what it does is it decreases food a lot. And people don't think about food, but some people do. Some people think about food from the moment they wake up to the moment they go to sleep. They think about when they should eat their next meal. And so it lessens that for certain people, which they never like first time for that's happening, which is so cool. And then that my internet's unstable for a second, and it's longer, which allows you to feel full for longer. But the other cool thing that it does is when food doesn't enter your bloodstream as fast, it lowers your glucose spikes, meaning your sugar doesn't spike as high. Why does this matter? Because this is something that's going to help increase your health span and your lifespan, because the less time spikes, you have less inflammation, which means less cardiovascular disease. So these medications are not just helping with also helping with works and how sugar spikes in your body. We care about sugar because that sugar and insulin about insulin resistance. And if you're able to manage that entire life, you are taking this medication as a full blown, it doesn't matter. You can always use it to jumpstart your journey. There's two different types of medications. We have Ozempic or Zepbound. GLP-1s are things like Ozempic, Wegovy, GIPs are trizepatide, which are like Mounjaro or Zepbound. In Mounjaro and Zepbound, which is trizepatide, there is a portion of GLP-1 in it. So meaning there is a combination of Ozempic, the Mounjaro. GLP-1s are more working on your brain, which means they're going to help with impulses, binge eating, addictive behaviors, and portion control. And GIPs are going to help you more with glucose management. So, for example, if you have chronic obesity, if you're insulin resistant, or you have menopausal weight, and so there's not habit changes that you need to. The medication working on your body. So depending on what why driven and it's not logically driven. And so what could you do when you take these medications to now shift your brain to do these decisions as a logical decision and not an emotional decision? And once that happens, you could then shift from your old habits to your new habits and then use this drug as a way of developing new habits, not as a drug that's suppressing your appetite and making a quick fix. Just a reminder to anyone that came in, remember, you could just ask on the chat any questions. Okay. So, microdosing. What does microdosing mean? What's the purpose of microdosing and why do people microdose? There are certain people that microdose just for the fact that they're nervous to go on a high dose. There are certain people that microdose because they went on the program or they went on the regular dose and they got to their weight loss goals and then they microdose to maintain it. There are certain people that go on microdosing because they are just wanting to lower their glucose spikes, or they just want to not gain weight, or they just want to use it for the anti-inflammatory benefits. But the purpose of microdosing could be so many different reasons per person. So some people go on it for weight loss. They usually don't have to lose a lot of weight. And so you can microdose on a GLP-1 to lose weight. You can microdose on a GLP-1 to maintain your weight. You can microdose on a GLP-1 just to decrease inflammation in your body. And you could actually microdose on a GLP-1 just to decrease that feeling in your brain of like the triggers that you have, the dopamine hits that you have when you feel I want something, that feeling when you want a cookie or binge eating. And you can microdose on a GLP-1 to get these effects. I'm a big fan of microdosing because I don't believe people need to take high doses to get results. You always want to achieve the highest value for the lowest dose possible. That's really where you're going to get the best results. Going on high doses, that does not necessarily mean better results. And so microdosing could work for a lot of people for many different reasons. So that's what microdosing is. And so either it's taking small doses every 7 days, or sometimes for certain people, it's taking it every 10 days. And certain people, it's not the lowest dose, but it's like not 0.25, it could be 0.50. And they're taking it, let's say, every 7 days or every 10 days. Everyone's different in terms of how they microdose. Believe it or not, there's no, even though Ozempic, let's say, has like a certain schedule of how you should take it, with microdosing, it's art and science together, and it's really up to the provider that's taking care of you to learn how to microdose you. It's microdosing is truly just providers doing this for X amount of years and learning the art and science behind it. It's based off of clinical experience and really talking to our customers and then learning how to adjust. And so we have microdose patients really on it for just like inflammatory disease processes like connective tissue disorders, rheumatoid arthritis, people who had Crohn's disease, PCOS, they microdose on it. And then there are certain patients who have been on it for the weight loss reasons. Then you get to your weight loss goals and then you microdose. The thing about microdosing is that it's always consistent and it's low. It's a lower dose and you're being consistent. The issue is when people think, I want to go on this drug and I'm going to go on and off of it, on and off of it. But when you do that, you're going to grow tolerant to it, and something over here called the window of opportunity. And so the window of opportunity means that when you take this drug, the first few months, it's so potent. Whether it takes you 4 weeks to get there, or you feel it in 2 weeks or 6 weeks, but in the beginning, it's really working on changing your brain. And just like when we treat someone for pain management, so example, if any physician is treating someone for pain management, we don't wait for the pain to come back to give you something to treat your pain. We treat your pain around the clock before it comes back. The same type of thing when you're microdosing or going on any GLP-1 is that you really want to build a cycle and allow someone to be able to change their habits over time and not go back and forth. I'm going to give you an example. Let's say someone's microdosing on a GLP-1 to change their habits, to lose a little bit of weight. They want to just lose 10 pounds. They just want to eat healthier and they want less inflammation in their body. And so they're microdosing on it. Now, if they take it and then 1 month in, they're doing great, they feel like they're losing weight, they're happy with what's going on, and they at month 2, they feel like they don't need it anymore. But if they haven't developed the habits, because it usually takes 3 months to develop a habit, they go off of it. Then they go back, let's say, to eating high sugar, high carbs, alcohol, and then they realize, okay, I didn't really change my habit. I gained the weight back because I didn't actually change who I am. All I did was take a drug to help me lose weight, and I didn't do anything differently. So then they go back on it. And the problem is when you flip like that, you lose potency of the drug and you also lose the window of opportunity. And then every time you do that, you're going to have to go on a higher dose because it's not going to work as well. And then you're going to max out eventually. 2.5, let's say for Ozempic is the highest, and for tirzepatide, it's 15. So if you max out, you're going to have to wait for the new drug to come out, which is not going to be out for everyone for at least another year. And so microdosing allows you to stay steady and really don't flip flop. Stay steady. You find a dose that's working for you and you stay steady at that dose and you don't go back and forth. So benefits of microdosing, again, you could have binge eating control from it. You could have less inflammation. It can control, let's say, less alcohol and less smoking if someone struggles with that. It helps with just cravings. It helps with inflammation. It helps with glucose spikes, which is going to help with your inflammation and help with energy levels. Think about if you eat a large meal after work or 12 o'clock in the afternoon, and then sometimes you feel sleepy. And that's because your sugar went up high and then it crashed. And so when you're microdosing on a GLP-1, you actually maintain your sugar spikes, which is so cool. You could even do this at a low dose. You don't need to be at a high dose for this to work, which is very cool. So when you're almost achieving the highest value for the lowest dose possible. Now, it really depends on why you're going on the medication to see if microdosing is for you. And some people, it works for them, and some people it just doesn't. So for example, if someone wants to lose a significant amount of weight, they're microdosing, it may not be appropriate for that person. They may need to go on higher doses. It really will depend on how it's working in their brain. Is it allowing them, what I spoke about earlier, having that split thought, meaning is it allowing them to break apart the emotion and the logic and then allowing them to act via logic? If it's not allowing them to act via logic and it's still allowing, and they're still making emotional decisions without eating, that means the dose isn't working in your brain and you need to increase it. If you went on microdosing just to lower your sugar spikes, or you went on microdosing just to decrease your inflammation, that's fine. It doesn't need to work in your brain as much. So it really depends on why you're using it. For people who are, let's say, menopausal weight gain, they can microdose on a tirzepatide because what they're doing is really helping restoring how their body's storing glucose. And with time, they will lose weight. They're not in a rush. It's 8 to 10 pounds. So they can microdose on it as long as it's working for them. So it really depends on why you're going on it and how do you microdose. Everyone's different. Sometimes it's every 7 days, sometimes it's every 10 days, and sometimes it's different for another person. Sometimes it's going on a little bit of a higher dose, but taking it every 10 days. And it always comes down to these main points. How is it working in your brain? And how is it working in your gut? And what are the decisions that you're making when you're on it? So are they different or are they not? Regardless whether you're microdosing or taking a GLP-1, for on high doses, you always have to think about, is the person going on it the same person going off of it? Meaning, did I change who I am and did I change my habits when I went on it and when I'm going off of it? If you're the same person doing the same things and just eating less because you're feeling full, but you're still eating the same type of foods and you're not changing your lifestyle, regardless whether you're microdosing or taking high doses, you're always going to gain the weight back. And most people gain the weight back because they don't use it as the window of opportunity and they're not being dosed correctly. Even either they're too low, but usually they're too high, which is why you see a lot of people complaining of nausea, vomiting. My friend was really sick on this. Unfortunately, those patients have been on way too high doses or they don't learn how they're supposed to eat on it. So when you go on this drug, again, whether it's microdosing or not, you actually have to eat differently. There's an art and science in how you eat, and all comes back to what I was saying before, glucose and insulin spikes. At the end of the day, the most important things that you want to control in your life is your glucose and insulin. And once you learn all the different things that affect your glucose and insulin, and how do I master controlling my glucose and insulin, then you will master your health and you will increase your health span and lifespan. That's 100% proven. Glucose and insulin are the two most important factors when it comes to controlling your health. And GLP-1s will control that. You can control it without a GLP-1, but a GLP-1 will control that. Whether you microdose or not, it will still help you with that. So I'm just going to talk about the drop method and what we do. So whether you're microdosing or not, this applies. So for example, the way we dose patients and how we help patients keep the weight off is by this special method. D is for dosing. So at the end of the day, microdosing or whether you're going on high doses, how you are dosed is going to be one of the most important things that will happen on your journey. Dosing is so important because that dose is going to determine how it's going to affect you. When your dose is too high, you get side effects. When your dose is too low, you think it doesn't work. And so understanding how the person should be dosed is so important. Understanding when to go up, when to go down, understanding when you want to go off of it. How do I decrease my dose and how do I get to, let's say, a maintenance or microdosing plan? But dosing is so important. At the end of the day, you want to, if you're not, obviously not doing this for diabetes management, if you're doing it for weight loss or something else, you want to make sure you're in the right dose and you want to stay at the lowest dose possible to have the maximum benefits. So dosing is one of the most important things. When people are dosing you, you should never try to figure out your dose yourself. When, as I said, the first 3 to 4 months are the most important times when you go on a GLP-1. The person dosing you should understand. They should be asking you certain questions. How is it working in your brain and how is it working in your gut? What are the decisions you're making? Because if you're on the right dose and you're not changing your habits and you continue to eat the foods that aren't good for you, and you don't eat it in the way you're supposed to eat your food, you're not eating it in the right order, then you go off the drug and you just are the same person. So whether it takes a month to gain the weight back or 3 months, a lot of people I speak to come to us and say, I went on this. I don't like Ozempic. It doesn't work. I literally was so sick for 3 months and then I gained all the weight back 6 weeks later. And that's because their dosing was off. So dosing is so important. Another thing that what's going to happen when you have dosing is something called real-time feedback. Pay attention. So if you're on a GLP-1 already, you want to pay attention to these things. And you could even test it. You could eat something that's high in sugar, which is going to cause your insulin to spike. Anytime you're on a GLP-1 and your insulin will spike, it will cause you to feel nauseous if you're at the right dose. It shouldn't cause you to feel nauseous it shouldn't cause you to feel nauseous in general, but when you eat something that's high sugar or going to make your sugar spike really quickly, or something fatty, anything that's going to make your sugar spike, it's going to give you real-time feedback. So instead of looking at the medication and saying, oh my God, this medication makes me so sick, it's actually going to say, oh, okay, this medication is giving me real-time feedback. I like to use the example of a coach. Let's say you have a coach and you're lifting weights and they're going to say, tuck your stomach in, put your hips forward. And then imagine you say, oh my God, it's the worst coach. He's telling me what to do all the time. And he's like, he's always like just saying, do this, do this, do that. Such a bad coach. But really it's giving you real-time feedback. Imagine the coach said only the next day, by the way, when you were lifting weights, you didn't tuck your stomach in. It's not going to help me. You told me the next day. And so the same type of thing with GLP-1s, whether it's on Ozempic or Mounjaro, Trizepatide, doesn't matter. When you eat sugar or fatty foods, it's going to give you real-time feedback, literally within 20 minutes. And it's going to tell you, I don't like what you just had. It's going to come in different forms. One form is nausea, one form is bloatiness, another form is gas, another form is indigestion. It's going to talk to you. So all of a sudden, what's happening, you're able to observe what your body wants. Your brain and your gut start communicating. That's when you know you're at the right dose. Now you have to start paying attention. Okay, so this is how we use the drug in such a different way. So now it's not about just suppressing your appetite. Because when you just suppress your appetite and you're not using it as a brain drug and you're just using it as a gut drug, then you really miss the entire benefit of the medication. And when you go off of it, you gain the weight back, which is what happens to most people. So what happens? We have something called the pause factor. Pay attention. When you're on the right dose, you have something called the pause factor, which means you see something you want and there's a moment. It's called delayed instant gratification that these medications cause. Delayed instant gratification, which means that you are going to have a moment where you're not going to feel the pleasure of doing something that's usually pleasurable to you, whether it's drinking alcohol, whether it's having a cookie. And so with this delayed instant gratification, it allows you to make different choices. So you'll say, okay, this cookie actually, I usually think it makes me feel good, but now I'm having a delayed instant gratification moment. And so I'm thinking, okay, actually, this cookie isn't really going to make me feel good. It's just my habits. And the trigger is not as strong anymore, so I'm able to make a different decision. You do that time after time after time, whether you're on high dose or microdosing, then eventually you're going to change your habits. And so learning how to do this pause factor, which all comes back to dosing, which is why microdosing is so cool. Because if you're with the right provider, they can microdose you to get these effects without going on high doses. Unfortunately, people don't understand this and they go on doses that are very high and then they max out. Once you max out on a medication, it's really, really hard to help someone. It really is hard. And then you can go to a different drug. If you max out on both drugs, it's again always going to help you with the glucose spikes, but it's not always going to help you with the cravings and the control. And it's not going to always give you real-time feedback. So really staying low as long as possible and using the medication correctly, regardless. Another thing people do is they flip back and forth from medication to medication. So they'll go from Ozempic to Tirzepatide. And when you do things like that, you also grow tolerant to the medication. So when you go on the medication, then you go off and you go on it, and then you go off, you lose tolerance to it, which is why microdosing is cool. It's better to stay in low doses for a longer period of time and learn how to make it work in your body and find the right dose for you and stay on it and keep to the habit versus going off and then going back on. Because if you do that, you won't ever be able to microdose. You're going to have to go on high doses. Okay, so now I'm going to answer a couple of questions that people have asked that they sent in, and then we're going to take questions from anyone that's puts on the chat. So just ask all your questions and we will try to go through all of them. So a patient asked that she's been on 14 milligrams of oral GLP-1, which is Rybelsus, for almost a year. Initially, she lost about 10 to 15 kilograms over the first 9 months. And then around April, 3 months ago, she had a Passover period of multiple large meals over the course of a week. My weight has steadily been increasing and I put on weight, okay, a whole dress size. The GLP-1 is no longer working to curb my appetite and I'm eating and snacking like I did before. This is a great question because it's so typical. It's so typical, and this happens to most people who don't use the drug correctly. The first thing is GLP-1s, so the oral medication does not work as well. It just doesn't. The injection works way better. Someone like her, I would say start again with the injection. The lower dose will probably not work for you, but it'll still work for you at a little bit of a higher dose. The other thing what happened is that she didn't really change her habit and she may not have been looking at the real-time feedback that we just spoke about and learning how to adjust. And so when you push through that and you don't listen to your body talking, so over Passover, what happened was the medication with time isn't as strong. And then she had multiple large meals over a course of a week. Now, once she did that, like once you mess up like that in terms of like the pattern and what you're doing, and she's already on the highest dose, then it almost stopped working for her. She wasn't able to use it as a brain drug. She was using it as a gut drug. And the gut drug at this point maxed out. Um, Meaning, if she would have understood that she's using it as a way to change her habits versus using it as an appetite suppressant, then and you see here she was on the highest amount, like this is 14 milligrams is pretty high. Um, and so she wasn't able to maintain the weight loss because she was just maxing on her doses, definitely not microdosing here, and just using the medication. So remember in the first slide, I spoke about what's your role and what's the medication role. And when someone maxes out on the dose and just makes the medication do all the work, meaning I'm not really changing what I'm doing, I'm not focusing, I'm not doing lifestyle modifications, I am going to gain the weight back. Here, the GLP-1 stopped working for her. Um, Once you start eating, let's say, the processed food and large meals and stopped working, now she has a problem. Either she stops it for a bit and goes back on it later, probably with injections. At this point, oral GLP-1s is really not going to work for her, or she goes on trizepatide. Someone who's probably been overweight her whole life, if that's her case, I do not know this person, then I would say maybe trizepatide would have been better for her. But the other thing I would suggest for this woman is going on a glucose monitor to understand her sugar spikes. So a glucose monitor is something we do that live time, we see what you're eating and how your sugar is spiking. She should be a little bit more aware about what's going on in her body and how her body is reacting to the sugar and her relationship with sugar and food and how much she's eating and how high her sugar is spiking. And so what happened was I don't believe she used the drug correctly in the window of opportunity that she had, and then she maxed out. So always go back. I love microdosing. Microdosing is like my favorite to me because you can go on low doses and get full effects if you're using it correctly. Most people don't, and then they max out, and then it doesn't work. Okay, a few more questions, and then we'll answer questions in the chat box. So, how do I use this through menopausal to maintain weight? So menopausal weight gain is a big thing. And what happens in menopausal weight gain is that a patient will just gain between 8 to 10 pounds due to menopause. There are times females that I speak to that say, I gained 30 pounds because of menopause, which is not true. No one's gaining 30 pounds because of menopause. It's 8 to 10 pounds that you could contribute to menopause. Now, if that happened, usually a lot of times as someone who just gained 10 pounds during menopause, they are likely doing everything right, meaning they are doing the right portions, they are working out, they're having a good lifestyle. Let's say they've been fit their whole life, and something like they can't even eat less food. Usually for these people, they need to increase their protein, bulk up on their protein, and go on more of like a GIP, not a GLP-1. So that's like trizepatide, and then get to the right dose that's going to start taking the sugar and storing it more appropriately. With this, it's a hormone imbalance. So it's not so much about the belief system or body set point or binge eating or cravings or changing your habits. This particular type of case, which is very different than others, is a hormone imbalance that you could correct with GLP-1s and or GIPs, and then sometimes potentially also do combo therapy with hormone therapy. It's very interesting. It's honestly very cool because we've never had a way to like two different things we never had a way, I mean, many different things. One, we were never able to cure diabetes. Now we could. We were never able to decrease someone's food noise of people that lived with it their entire life, and they didn't even realize that that was not normal and that they could live a life without it. And the first time ever, we could treat hormone menopausal weight gain, which we were never able to do. And now we could with microdosing on a GIP, which is like trizepatide. If you eat protein and don't drink water so much, could that hinder weight loss? Okay, a couple of different things. When you just like when you go on these medications, you don't recognize that you're as hungry. You don't recognize that you're thirsty. And so again, it always comes back to doing things that are logically what you need to do versus emotional. And when you start this, you need to be intentional. You need to be super intentional. I'm starting this for these reasons, and these are the actions that I want to change. You need to write it down on a piece of paper and say, these are the things that I want to change. These are the things that I don't want to eat anymore. It's not about restricting your body. It's about protecting your body. It's your temple. It's trying to take care of it, observing what your body wants. And so It's not that I don't feel thirsty, I'm not gonna drink, it's intentional. I know I need to drink water, I know I need to eat protein, and making those decisions now because the emotional triggers aren't there, but you still need to make the logical decision about what you wanna eat for breakfast, lunch, or supper. If you wanna eat twice a day, that's fine. What do you wanna eat? Timings, like all of these things should be thought about and should say, I want to consistently do this. If you cannot maintain it when you're off the GLP-1, don't do it when you're on the GLP-1. The decisions you make should be that you can maintain it. Okay. Another benefit why I like microdosing is because it's more subtle. It's not drastic. It's not these drastic changes that people are taking, and they're able to really focus on the habitual changes they want to make. What is the upside to slowly increasing your dosage, which means not losing weight first? So, first of all, one, going on a lower dose in the beginning is totally fine. Certain people find it to be a very strong dose, and certain people don't. And certain people, maybe it takes time to get to the right dose, but it's always better to go slow because if a lower dose works for you, that's great. Like once you go to a higher dose, like you really can't go back. And so try your best to stay at the lower dose as long as possible to really get those sort of results. Now, if it's not working for you in your brain, which you'll decide with your practitioner, then you'll go up because that's what you need. Um, okay, and what exactly is microdosing and how does it differ from standard dosing? So it's a lot lower. You're not upping it every 4 weeks. So regular ones, you're upping it every 4 weeks, which is something that I do not like in general. You really want to stay lower for longer. And you're taking it every 10 days, you're taking it every 7 days. It depends on what we're trying to treat and what we're doing. And you're staying at a steady dose. And it's so important with microdosing that you're not going flip-flop. You're not going on it, you're not going off of it. You're staying on the same dose and you're having consistency. At the end of the day, slow and steady wins the race, and it's the consistency that really matters. So, great. Those are the questions that we have here. And now we are going to answer questions on the chat. So everyone can ask some questions on the chat. It could be detailed, it could be general. So would microdose lessen side effects if taking the regular amount gave a lot of stomach issues? 100%. Always push for microdosing if you're getting the effects that you want. Again, what do we speak about? People who, let's say, are having stomach issues, I would look into what are you eating when you're having stomach issues? Doing a glucose monitor with anyone who's having like nausea a lot. Sometimes people aren't really aware about what's spiking their sugar. And so you should go on a glucose monitor, which we do at IV Drips, and we look at a 15-day period of what's going on. But I would also write down like what happens before your stomach started hurting. What did you eat? Most of the times, either it's fruits, fatty foods, high sugars. In general, when you're on a GLP-1, go off of fruits. Like unless you're eating it with something protein, like acai bowls, like are a big no-no. Alcohol, no-no. High protein, yes. High amount of hydration, yes. So yes, if you're having those sort of side effects, definitely microdose. Now, it depends. I don't know your story, but it could be that if you try going down, the effect that you want in your brain may not work anymore. So you have to see, or you have to adjust you have to have someone who understands to dose you correctly. You have to figure that part out. Is it possible to stop the medication after achieving weight loss goals? Really, really great question. Even the changing habits, um, okay, so she's asking, is it possible basically to go off the medication after achieving your weight loss goals, which is 100% it is. But as I said before, most people gain the weight back. So how do you go off of it and not gain the weight back, right? That's the big question here. And it's going back to that drop method. It's getting the right dose that's working in your brain and your gut and giving yourself real-time feedback and then listening to what your body wants. And so for example, so we do weekly group meetings and to help clients like just really communicate with each other, listen to pain points, and learn from each other and hold each other accountable. And so I had a client in one of the group meetings say, every morning I usually have a cookie with my coffee. And I did that because my mother did it. So talk about lifestyle and just things passing on from generation to generation. But she said when I went on a GLP-1, I thought I actually don't need this cookie, but I take it out of habit. Um, Another woman said she always had like snacks after dinner, and she realized that she wasn't hungry after dinner and she had her protein and she was good, but she kept doing it out of habit. Even when she was on a GLP-1. And so then she had to learn, like, oh, now's the time. It was like the beginning of her program where she was like, oh, now's the time I switch. So what did we do? We switched it out for tea. And now she drinks tea instead of the those snacks that she was having. And then that became her new habit. And so when she's going to go off the GLP-1, she's going to titrate slowly because you always titrate slowly. You never stop it abruptly. So she's going to titrate slowly to go off the medication. And as she goes down, we're going to see how's it working in her brain. Like, did the habits come into play? And then you see as you go down and you start doing some sort of microdose level, you start saying, is it working? Am I returning back to my old habits? Am I returning back to my old self? Or am I a new person? And that period is so important because if you're returning back to your old self, that means you didn't use the drug correctly. Um, so uh, this question was she's asking about menopausal weight gain, going and the good thing about this is sometimes actually with the menopausal weight gain, you can go on these medications and adjust your habits. Sometimes you don't even have habits to adjust, but with menopausal weight gain, you could just microdose on it or go off of it after you achieve your weight loss goals because it actually shifted the way it works in your body. And so it's not so much that you're going to go back to old habits because it's the same habits. Sometimes you can go off of it and you'll keep the weight off. Sometimes you may just have to go on a low dose and stay on it. Depends on the person. Okay, thank you. All right. Is there an off ramp eventually? Okay, so take a couple more questions. So as you go off this medication, if you stop it abruptly, what's going to happen is that your body and your brain is all of a sudden going to be like starving, right? If you are on a high dose, this is the danger of going on a high dose and then stopping. Your brain is like, forgot how to do portion control because you were never hungry. So the dangers of a high dose are like really, really dangerous, especially if you're not using it correctly. Um, with microdosing, you don't have that problem as much because also remember, we spoke about the brain doing certain things and the drug doing certain things. And so with the microdosing, it's really playing that beautiful balance of what are my habits? What am I changing? And what's the drug helping me with, right? What is the drug helping you with? The drug is helping you feel full for longer and decreasing your food noise. But the other thing the drug is helping you is that pause factor we spoke about. It's delaying instant gratification. And you could get that when you're microdosing. You just have to pay attention for it. Are you getting it? It's almost as like these drugs are working, but we have to listen to it. Like the brain and the gut are talking to each other, but we really have to pay attention and listen to it. And so if you're microdosing and you're finding that you're not getting that, then you have to understand what's going on. Maybe you do need to go on a higher dose. Um, and so once you, let's say, an example of a patient who wanted to lose 30 pounds and then she reached her goal, what does she do now? So whether she's microdosing or not, what we'll do then is we'll slowly take her off. So depending on her dose, either we will lessen her dose and she'll still take it every 7 days, or we'll keep her dose the same and we will put it for from 7 days to 10 days and then eventually spread it out. Or sometimes we'll do both. The way we structure that is based off of how it's working in her brain. And as we take it off, we ask her, how are you feeling? What's happening? And what are the decisions that you're making? And is it matching up to what we want? If someone starts going off the drug and they're just all of a sudden reverting back to what they did before, it's not a good sign. It's a sign the drug didn't really work for them. All the drug did was just suppress their appetite, but it's showing that they didn't eat the right foods when they're on it, right? Eating the right foods when you're on it is so important. And so those are the different things that you want to pay attention to. Okay, we're going to wrap up soon. So let's see any other question. It's retraining your brain basically to do the job of the meds, correct? So this is like a great time when you're on a GLP-1 to retrain your brain. The window of opportunity. The first 4 months that you're on this drug, you're retraining your brain. You're having a delayed instant gratification, and you're going to start thinking what my body feels and not running to habits. In general, it's really hard to change habits. But what if there was something that could change our brain to not have the triggers, to not have that impulse, to not have that dopamine hit, that we could just logically say, you know what? I actually don't want to eat this right now. I'm actually full. I don't need to eat more. I actually don't want that. All of those decisions you can now make and then change your habit. And it becomes so much easier when you're on a medication that's fixing your brain. Um, okay. What would be the cause of feeling faint while you're on the drug? I'm curious to know what dose you're on and how much you're eating, how much you're hydrating, how much grams of protein you're eating. Like, are you eating enough food? So if you're feeling faint on the drug is supposed to give you more energy. High chances you're not eating enough. When you have any sort of side effects of like Ozempic face, Ozempic butt, people worry about like osteoporosis. You have to think, if you ate this amount of food, whether you're on a drug or not, would that be healthy? And if the answer is no, then it's about your decisions that you're making, or you're on a dose too high. But at that point, it's not about the drug. It's about the fact that you didn't really take care of your body. Now, if you're not able to eat the amounts of protein and grams of food that you're supposed to eat when you're on this medication, then one, it's not sustainable, and you're just going to gain the weight back because it's just suppressing your appetite, and it's not really teaching you how to eat. And the point is, it's supposed to teach you how to eat when you're on it. Does microdosing make sense for a menopausal woman looking to prevent weight gain that can come from menopause, even if they have healthy habits? Yes. This is amazing. This drug is like amazing for menopausal weight gain. There has never been a drug out there that helped women who gain weight from menopause to help them lose weight. I've had amazing results. If you have gained weight due to menopause, 8 to 10 pounds, going on a GLP-1 or GIP will change your life. I mean, this is like the best drug that I've ever seen for menopausal weight gain. So, okay. How can you prevent muscle loss? It seems like a problem for many. Okay. One thing is, once you hit 30, every single year you lose muscle. Okay. People are very concerned about Ozempic on muscle loss, which is interesting to me because a lot of people don't work out. And so if you don't work out in general, whether you're on a drug or not, if you're not lifting weights and doing resistant training, which is not about weight loss anymore, it's about building strength and being strong and glucose and helping with your glucose spikes. But every single year that you don't lift weights or do resistant training, you're losing muscle. Now, if you don't lift weights and then you go on a GLP-1 like Ozempic or Mounjaro, tirzepatide, and then um, you lose weight at a rapid amount and you still don't work out, then you're losing muscle and fat together. If you didn't go on a GLP-1 and let's say you took phentermine or Adderall, or you just decided not to eat for months on end, whatever it was, right? And you didn't work out, again, the same thing would happen. You would lose muscle and you'd lose fat. But why is it such a popular conversation is because there has never, ever been in history of our time this many people that have lost weight in such a short amount of time. Like, this has never happened in our lifetime. And so that's why it's such a popular conversation. When you go on a GLP-1, you need to do resistance training. You need to learn how to eat. If you don't, then you will have every single side effect that you will get by suppressing appetite and not eating enough food. Like, that's going to happen. And so you really have to work out. Why is resistance training so important? The more muscle you have, one, the more calories you can eat, and two, muscle is going to help break down the sugar. And so let's say we spoke about people who are insulin resistant, people who have menopausal weight gain, the more PCOS, the more muscle you have. So think about the organ, which is the largest muscle in your body? Your legs. If you do exercise that are going to make your legs stronger, squats, lunges with weights, if you do that and build the muscle, what's going to happen? Your whole body's going to change because you're now having more muscle and your glucose is going to be broken down at a faster, better rate, which is a lot of reasons why people gain weight and can't lose it because of the insulin resistance, which happens to a lot of people who have chronic obesity. So the more muscle you have with that, and then as you age, the risk of falling and losing that muscle is so much higher. Okay. And so we always looked as working out for many years as a way of losing weight, but it's not really about weight loss. It's about strength and metabolic health because the more muscle you have in your body, the better your glucose and insulin dance will be. You care about your glucose and insulin dance because your glucose and insulin dance will predict your health. Now, we could put someone on a glucose monitor that their blood works fine. It's showing that they're not diabetic. But I could see live time after you eat 20 minutes later, how high your sugar spikes. And from there, I can understand if you're on the pathway to becoming diabetic, even though your blood works okay, because that glucose and insulin spike are going to determine your health, almost how long you'll live for. So how do you control that, right? We said you go on a GLP-1, you control that. You control that based off of how you eat. The order in how you eat your food matters, and how much muscle you have. So if you have more muscle, then you could break down sugar better, and then your insulin resistance is less, and then you have less inflammation, which means you have less cardiovascular risk. And so all of these things are so important to really understand how to improve your health. Now, GLP-1s maybe were thought about in the beginning of this conversation as a weight loss drug, but they're not. They're longevity drugs, and they're drugs that are going to help you live longer and control your sugar spikes. You could do this via microdosing. You don't need to go on high doses. As a matter of fact, I don't agree with high doses to get these sort of effects because you can achieve everything on a lower dose. And so understanding that is really a game changer for a lot of people. Okay, great. We are going to wrap up now. Takeaways are very important to know that microdosing differs from person to person. Not everyone has the same microdose amount, and how often you should do it also depends. At the end of the day, you want to think about two things. How is it working in my brain and how is it working in my gut? Is it controlling my decisions or am I controlling my decisions? How much work I'm doing and how much work the medication's doing. And how full am I? Am I full after food? Am I still reaching for the second portion or now I'm full after the first portion? So that's good. That shows that's a good sign. And then thinking about what are the decisions I'm making on it, the delayed instant gratification, and could I change my habits through it? Like, is the medication working enough that it's allowing me to change my habits, or is the medication doing all the work and I'm just like, I don't even want to look at food. When you go on this drug, it's important to be titrated to find the right dose for you. And then when you go off of it, you have to be titrated off of it because you don't want to shock your body by being, especially if you're on a high dose, to just all of a sudden go into a lower dose and all of a sudden you're going to get strong cravings of being super hungry and you don't know how to manage it. So anytime you're going off this drug, you always want to go off slowly. And that's very, very important. Microdosing is really one of the best methods as long as you're able to achieve what you want in your brain and gut and not flip-flopping. So don't go from medication to medication. This is why it's so important to be with a provider who's helping you, because if you're doing guesswork, and I speak to patients all the time about this, when they guess and then they come to me when they're like at 10 or 12.5 milligram of trizepatide. It's really hard to help people at that point. It's really important to get help at the beginning of your journey. Because when you max out on those meds, it's like very hard for us to help you and try to make it work in your brain anymore. And then when you flip from med to med, you also grow tolerant to it. So people go from Ozempic to trizepatide and they're like, Ozempic was working better for me. Then they go back on and the dose doesn't work for them. So they have to go higher. And so don't abuse the drug because you could abuse it and then it won't work well for you. So use it correctly the first time around so that it not only will help you lose weight, but it'll help you sustain the weight. And we do know that most people do lose weight on these medications. It happens, but most people don't sustain it when they go off of it. And so the whole point of what we do is really teaching patients how to lose weight, but also how to keep it off. And that's done through the methods that I spoke about. And a lot of times it's not even about eating less, it's about eating right. And so that's it for today. You can get our information at hellodose.com or on Instagram at hellodose, or IV drips. We do consultations, and you are assigned to a nurse practitioner who guides you throughout your way, whether you're doing high doses or GLP-1s. Our nurse practitioners are, or you're doing microdosing. Every single one of our nurse practitioners are understanding how to microdose because that's what we specialize in. It's a big we're very passionate about it, and adjusting your dose accordingly. There's no one size fits all with GLP-1s because no one's weight loss journey is the same. And a lot of people don't go on it for just weight loss. Some people go on it for inflammatory disease processes. Some people go on it for Crohn's disease. Some people go on it for binge eating. Some people go on it for addiction. Some people go on it for alcohol. And we put patients on it who are bulimic. And so it helps with their purging. That's addictive in their brain. And so there's so many uses of this drug. It's not just about weight loss anymore. It's really about a longevity drug that controls your impulses and your metabolic health. So that's one thing I would leave you with is, oh, wonderful. Great. I'm going to tell Victoria that. One thing I would leave you with is the one thing you want to think about when you want to go on a health journey is thinking about your metabolic health. What are the different things that I could do to change my metabolic health? And what are the different things that I could do to control my glucose and insulin? If you want to learn more about glucose and insulin, then we can put you on a program. It's 15 days. It's a monitor that checks your sugar. It's in the back of your arm. It's lifetime. Everyone should do it once in their life. It's amazing. And for the first time ever, you can actually see what spikes your sugar. You don't have to rely on these packages that say no sugar. You really could see what's going on. And then you could change your habits based off of real-time feedback. Real-time feedback is always going to be the best thing that you ever could do to change habits because, again, like if the coach will tell you the next day that you didn't tuck your stomach in, it's not going to help you. But if the coach told you the time you were lifting the weights, and so GLP-1s like Ozempic or tirzepatide give real-time feedback, and a glucose monitor gives real-time feedback because your sugar spikes within 20 minutes and it beeps on your arm and you get to see it and then you get to pivot. So super cool. Okay, thank you everyone for joining, and you all can reach out to us on our website, hellodose.com, or our Instagram page. Thank you so much, everyone.